This is Healthcare's Missing Logic podcast, episode number 142. Today, our special guest is Dr. Karen Mueller. We talk with Karen about her research on burnout and physical therapy students and faculty and the implications for students and new clinicians entering the workforce. Stay tuned.
Welcome back to Healthcare's Missing Logic podcast. This is the only podcast that shows you how to leverage polarity intelligence, an essential competency for healthcare leaders, and the missing logic in healthcare, so you can create healthy, healing organizations and become a thriving, resilient, and unstoppable healthcare leader.
We are your hosts, Tracy Christofferson and Michelle Trosett. We've been best friends and colleagues for over 30 years. And during that time, we coached healthcare leaders across North America around how to create healthy, healing organizations.
Today, we coach healthcare leaders and leadership teams to live thriving, resilient, and balanced lives, combat burnout, and create the best places to give and receive care.
This podcast is for the unsung hero of healthcare, the healthcare leader. We want you to know we see you and we'll be here for you each week. In this podcast, we're going to challenge healthcare's industry norms, flip limiting beliefs, and share proven strategies so you can be your best self at work and at home, live and lead intentionally, and experience well-being and joy.
We are glad you are here and look forward to sharing the journey with you. If you aren't totally convinced this podcast is for you, just listen to a few episodes and convince yourself. Well, welcome everyone to another episode of Healthcare's Missing Logic podcast. This is Michelle.
And Tracy.
And we're back again for another fantastic episode, another guest episode.
Yeah, it's always fun to have guests. Gives you a lot of energy.
Yeah, it does.
And she's our first we're in a new batch season here, folks. So she was our first guest in this batch.
Yes. And she started it out fantastic. So who are we talking about, Trace?
Talking about Dr. Karen Mueller.
Oh, yes.
Yes, and she's a physical therapist. Yay, physical therapy.
Shout out to all the physical therapists out there.
Yeah.
And we talked to her about her incredible research on burnout and self-compassion and compassion for others. And just for the record, we know every health profession is impacted with burnout. So if you think of anyone else that wants to be on our show, the door's open.
Yeah, let us know. Well, I think it's just so encouraging to hear, not necessarily to hear the results of a research, which is students are burned out, right? But
yeah,
but just that other people are starting to do research for the other professions.
Yes.
Because I think we need to know what the realities are for all the health professions. So I just really appreciate her sharing her research with us and our listeners and just seeing that. It gives me great hope.
Yeah, I agree.
We're gonna learn more.
Agree. And you will listen to her wonderful story too. There's a lot of lessons in her personal story, which I can't wait for you to listen to.
Yeah. And I mean, I think too, along with just what the results were, that she's actually implementing changes and doing things differently and being innovative in her approaches to help students, combat burnout and manage the stressors of, being in accelerated programs and academic settings. And, so she's taking action, which I just love.
Yeah. Yeah, I agree.
That really gives me hope.
Yes.
Because, my takeaway from our conversation too was what we experience as students and learn as students and coping mechanisms we just carry right on into our professional careers, right? Mm-hmm. And so if it's not healthy as a student, it's not going to be healthy as a clinician. Why we're in the situation we're in.
That's exactly right.
Yeah.
That's exactly right.
Yeah. Well, let me introduce you to Dr. Karen Mueller. So Karen is a professor and founding core faculty member in Rasmussen University's Developing Doctoral Physical Therapy program, which will launch in January of 2023. So this is a brand new physical therapy doctoral program. Before joining Rasmussen University in June of 2021, Karen served for 34 years in the physical therapy program at Northern Arizona University in Flagstaff, Arizona. Karen's research interests are in the areas of physical therapy, student well-being, and compassionate end-of-life care. She has presented nationally and internationally on both topics and has also published several related articles. Karen is the author of Communication from the Inside Out, Strategies for the Engaged Professional, and a national board-certified health and wellness coach. And it was just a pleasure to talk to Karen. So without further ado, here's our interview. Welcome, Karen, to Healthcare's Missing Logic podcast. We're so happy to have you on the show today.
Hi, Tracy and Michelle. Thanks so much for inviting me. It's really a pleasure to be with you today.
Yeah, well,
we're excited.
We're super excited to have a physical therapist on our show today.
Great.
Yeah, right.
Let's hear it for the PTs.
And one that shares so many passions that we have, right? And so one of the things that we always kind of like to find out when we have different, healthcare professionals that are on our show is kind of your origin story. So tell our listeners a little bit about how you came to be a physical therapist.
It was not a direct route, kind of a sideways route, but I grew up in a family of health professionals. I had my favorite aunt was a nurse and loved her work, but worked the night shift. And I'm like, ooh, that's tough. But loved her work. So that excited me. And then I had my father and my brother who are psychiatrists. And our dining room table conversation was often around, what my father would tell us about how to have good well-being and take care of your relationships and have a good marriage and love your work. And that really resonated with me. And I actually thought about going to medical school and becoming a psychiatrist. But I quickly realized that I'm too extroverted to sit quietly and listen to people all day. I know that sounds heartless. I still had a passion for mind-body wellness. And I did inherit that from my father and my family. But I didn't know if just sitting quietly was the best way for me to help patients who had those issues. And by chance, one day I was on campus at the University of Missouri where I was going to college and ran into a dear friend who I hadn't seen in years, who was now at the university studying physical therapy. And that caught my attention. Like, here's an opportunity to get involved, be active, run, do the movement. I was really into the running craze in the 70s. It made total sense that this would be a great way to integrate my interest in mind-body health in a profession where I could be active, still have strong relationships with my patients, and treat them as holistic persons. So it was a sideways entrance, but it turned out to be one of the second best decision I've ever made. The first was marrying my husband, who's also a physical therapist. We've been married 38 years. I met him on my first position at Rehabilitation Institute of Chicago. And my second best decision was becoming a physical therapist. And this year it will be my 43rd year as a physical therapist.
I know it's always hard to say that, isn't it?
Wow. Yeah. But just think of all the amazing experiences you've had over those 43 years, right?
Yeah.
And just how you've evolved yourself, right? I'm sure as a physical therapist, as a person, because of those experiences. So
absolutely.
There's lots of wisdom packed into you, Lee.
Yeah.
There you go. Thank you.
Yeah, and how great that you could share that journey with your husband. That's really cool too.
Yes, we were colleagues, and Rehabilitation Institute of Chicago was, and now it's the Shirley Ryan Ability Center. But at the time, that and Rusk Rehabilitation Center were the two top rehab centers in the country. So I did have the opportunity to work with a variety of patients with different disabilities. And at the time in the 70s, before managed care, we would see our patients for 3 months, 6 months. So you really develop relationships.
Yeah, I think that's one of the great things about rehab, right? It's the ability to really follow them on their journey and be a part of that and to really help them. Yeah, I think that's fabulous. Well, as you know, Michelle and I are on a mission, right, to help healthcare leaders combat burnout and to develop resilience and joy in their lives. And especially now after the last 22 months, right? I mean, it's just been a long, long time. We've been on this journey and it's been a tough one. And we know you have a personal and professional story about this. And so let's start with your personal story. Like, what have you personally learned about stress and burnout through the pandemic?
It was kind of an acid test. I will categorically say that 2021 was the most challenging year of my 65 years on this planet. It's when 2020 hit, when the pandemic hit, I was joyfully engaged at a public university in Arizona. I loved my colleagues. I loved my students. I could never imagine leaving that position. And then COVID hit, as we all know. And we all pivoted. I guess that was the big word. We all went to online, but there was a sense of solidarity because we thought, oh, it's only going to be the spring semester of 2020. And so there was a great sense of excitement. And then as it wore on and the financial impact of COVID hit our university in the fall of 2020, there were some drastic changes. They were trying to survive financially. And so there were faculty hiring freezes. There was a requisition process for equipment. There was a bunch of stuff that, again, my university, I will never speak ill of it. Northern Arizona University, I will always love that place. And just like other public institutions, they had a financial crisis. And, but it was really hard. I'd been there for 34 years, and the way I was used to delivering, my lectures and having the support I needed wasn't available. It just wasn't a possibility. And so I made the very, very painful and difficult choice to start looking around. And the thing that also exacerbated it and made it a scary situation was that I was diagnosed with hypertension. And I live a really healthy lifestyle. So I couldn't lose more weight. I couldn't walk more. It was stress, nothing more than that. But it was terrifying. On a couple of occasions, my blood pressure was dangerously high. And so there was this urgency of having to take care of myself that I think really accelerated my decision to leave this wonderful university that I just loved. And so that was painful. And what I learned about stress is sometimes there is nothing more you can do that be in it and be with it. I had sleepless nights. I tend to be an anxious person and I tend to catastrophize. So I had to really be with that. And it was painful. There's no two ways around it. What I did learn is how important it is to be mindful and to not add layers of self-judgment on top of the anxiety that I was already feeling, to validate the decision to leave the university, which was so painful. And then to also realize that there's other great opportunities out there. The happy ending of this story is that I found another position with one of my all-time career mentors, who happened to hire me at Northern Arizona University 34 years ago. So there was this huge coming to full circle that is the happy ending of all this. But in the midst of being very anxious and sleepless, I learned several things. Probably the most important thing, of course, is mindful acceptance. I think when something with COVID hit, I think we all faced our mortality, which has always terrified me. Even though I've worked in hospice and palliative care, the thought of my own death was terrifying. I've learned to come to terms with that. It's been quite a process, but I think just being more accepting of things in the moment, no matter how painful they are, has been really helpful to me. I'll stop. I know I've been talking a lot.
No, it's great.
That's why you're here. You're here to talk, Karen.
Exactly.
Okay.
So it sounds like that mindful acceptance was a major factor that helped you regain balance in your life, in addition to making a courageous decision and recognizing mindful choices are really important. Is there anything else that really helped you regain balance in your life at that time?
Two other things. I realized that I have a very negative self-explanatory style. So in this, if you've read the work of Martin Seligman in terms of explanatory style and optimism, pessimists take bad things, they make it globally affecting every part of their lives. They make it permanent and they make it their fault. And so I was kind of internalizing all of this, beating myself up, thinking, when will this horrible stuff end? When will this hypertension end? And then I realized, if you don't change your mindset, those aren't going to go away. So I actively began to cultivate a more optimistic mindset of looking at things more positively, of seeing negative things as self-limiting, not affecting all parts of my life, right?
Yeah.
And the thing that helped me, the hack, I think, to an optimistic mindset is gratitude. Mm-hmm. And so I began to like become a gratitude fanatic. Like, oh, look at the bird. Look at this. This is wonderful. As crazy as that sounds, it begins to become self-fulfilling. I have found that to be probably the most helpful thing I have done, is be more grateful.
Well, when you're grateful, you're happy.
Yeah.
Right.
And
It
it
raises your
sounds-
vibration.
Yeah.
Mhm.
And it felt disingenuous at first to go, okay, I'm happy that I slept for 2 hours last night. Better than the night before where I didn't sleep at all. And so the beginning of just starting to ramp up little bits of gratitude allowed me to see greater opportunities for it.
Sure. Baby steps.
Yeah, they are baby steps. And look at you now.
Yeah.
We didn't know you then, but you seem very happy and grateful now.
I'm in the, yeah. One other thing can I add? Because I think you guys will get this, the importance of reaching out.
Yes.
You know, when you're hurting and you are at the thrall of a chronic illness, like I felt like I was, there was a part of me that just wanted to buck up and see if I could get through it. And then I realized that could have a really bad outcome. So I was really forthcoming in reaching out to my counselor, to my healthcare team. I reached out to friends. I really, really tried to keep my social network as strong as I could, which for me, being an extrovert, was absolutely an essential part of my mental health.
Yes.
So,
Yes. Wow, you've already given some great tips, and we are just getting started.
Okay, I guess we're done. No, just teasing. We got a lot more here to go.
I know you do.
Okay, Karen, you contributed to some important studies related to burnout and compassion with physical therapist students and faculty and clinical instructors. And the first was published in 2018 in the International Journal of Health and Wellness and Society on patterns of academic burnout, emotional distress, and coping. And can you briefly share with our listeners, what this study with doctoral physical therapy or DPT students revealed?
Yes. First of all, a shout out to my colleagues who were collaborators on this paper, especially Petra Williams, who was the lead author on this paper. So all these great things are done with other people helping. But we began to see we have a doctoral program in physical therapy, and that is the standard for physical therapist education across the country. And the demands are really rigorous. I mean, we had an accelerated program at NAU. So the students are in like 20 credit hours a semester. They're trying to learn all this information. They're trying to develop clinical skills. The stress levels we began to notice were high. So we decided to undertake a longitudinal study of student burnout and stress. And the paper you're referring to was the first paper from this. We've got others in the pike right now. But we wanted to do two things. We wanted to compare levels of burnout in all of the students on our Phoenix and Flagstaff campus. That was 163 first and second year physical therapy students. We wanted to compare their levels of burnout between January, right after Christmas holidays, everything's great, and May, when a lot of them are taking practical exams, getting ready to go out on internships. What is the level of burnout in one semester? We just thought we would give it a shot to see if we were even on to anything. And then the other thing we were curious about was, what sort of coping behaviors do people use? And we divided up coping behaviors into 10 different ones, looking at what we called more active strategies, like playing with pets, hanging out with friends, cooking, doing things that, nurtured you, as opposed to more passive things like watching television, drinking alcohol, overeating, things like that. So we wanted to see that as well. And we used the Oldenburg Burnout Inventory to measure exhaustion and disengagement. And then we looked at the depression, anxiety, and stress scale to look at depression and anxiety. And so we were kind of blown away by the results of this study, that in one semester, depression, anxiety, all of the levels that we were measuring increased by 22% for the entire cohort. And 40% of these students were reporting moderate to severe levels of stress and high levels of disengagement and burnout. So here we're seeing in one semester, these students were very stressed, 40% of them in the severe category. So that's the bad part of this. Now, what helped? We looked at the coping strategies.
Mm-hmm.
And what we found, sadly, is that, again, I mentioned the 10 behaviors, the positive and the passive ones. The negative, as the levels of stress and burnout increased, all coping mechanisms decreased except slight increases for eating, drinking, alcohol. Okay. And only 25% of students increased one coping behavior, positive coping behavior. And that was spending times with family and friends. Okay. So for those students that spent more time with family and friends, there was significantly less depression and anxiety, which really was fascinating. They took the risk in the midst of a very rigorous program and said, I'm going to spend more time with my family and friends, which seems counterintuitive, but they were the only ones that were protected.
Yeah, that's a great result.
Well, you got to fill your cup.
Yeah. Right?
Yes. But it is counterintuitive, isn't it?
Mm-hmm.
Yeah.
Mm-hmm. Yeah. It's the opposite, right?
Yeah.
And I noticed in the study, those that didn't, right, they kind of went into like a survival mode, right? Like they were increased pressure, increased time, decrease everything else, right?
Exactly. Yes.
And that's what we do as clinicians too.
We do. We just think, I don't have time. I'm not worth the effort. What if, the guilt trip, and that's a whole other layer of things that I can share with you as well.
Yeah. Yeah.
Yeah, that sounds really great to uncover that. And was there any other things you learned about that family and friends piece other than just the data results? Was there any other
you asked a great question about interpretation. What do those results mean? Why were those important? And one of the things I'm very interested in looking at is the impact of social connection. So I'm a health coach too. So trying to get patients involved, clients involved in health behavior change often means finding the relatedness part of self-determination, right? Getting friends and family involved. But what's fascinating is the health impact of low social interaction. And so I just wanted to quote a study that was published in PLOS in 2010. So this is an old study. And they looked at 148 studies involving over 300,000 participants. So this was they cast a wide net. And what they found was that low social interaction was equivalent to smoking 15 cigarettes a day or being an alcoholic. And it was more harmful than not exercising and twice as harmful as being obese. So social interaction is a huge, critical health behavior. Another study in 2017 that was published in the American Journal of Lifestyle Medicine found that strong social interaction is protective of longevity by up to 50%.
Wow.
So for all of us health professionals, I think if we realize that keeping our social connections intact is a health behavior, we might feel more compelled. It may be more legitimized.
Yeah, exactly.
Too bad we need to have...
I know Michelle's doing the happy dance because she's such a social person. So now she's like, see, now I'm validated. Every social activity I do is validated.
Darn right.
I knew exactly what was going through her little head.
I'm like circling this.
Yeah, she's like, oh.
That's important data.
Oh, yeah.
But I think it's important for faculty to be aware of that, right? So you can encourage that and you can build that into your, how you can help the students during these stressful times.
Well, and I think, it's typical, right? When you become stressed or depressed, you tend to go in, right? That's just the natural tendency. And so you tend not to ask for help or you tend not to reach out. And I think one of the things that we've also been working with, like with leaders too, is connect with each other, right? Yes. So this whole, dynamic around keeping up with the other leaders, right? And if you can't, then there's something wrong. Same thing with students, right? Like if other students are flourishing and you're not, there's that whole dynamic there. But it's really about connect and support each other wherever you're at in your, emotionally and, as well as academically, right? It's just
absolutely.
It's very important. Mm-hmm.
Yeah. So no, thanks for bringing that up, because I'm in this wonderful position now of creating a new physical therapy program at Rasmussen University. And this is going to be a hybrid program where all the didactic will be online, and then we will be doing residential immersions once a quarter, so every 12 weeks. So I'm very mindful, and I know my colleagues are too, about how do we create that kind of connected culture in an online teaching environment.
Mm-hmm.
So we're going to be very thoughtful about how we do that, but students will be from all over the country. How do we connect them? How do we make them feel part of a small community? I think that will be essential for the success of our program.
Yeah.
Yeah.
I totally agree. Agree.
Actually, I'm in a PhD program, and I was just talking with my chair about how do you connect PhD students, because I'm also in an online program. It's very isolating when you go into your PhD work, right? Like you're in your study. And she's like, I just thought it would be really helpful to connect. I'm like, yes, because you just feel like other than your chair and your committee, you're kind of out there alone. Yeah,
absolutely.
You don't really have a lot of connection, right? So same thing.
Yeah.
Yes.
Yeah.
Yes.
Mm-hmm. Community is very important.
Yes.
Yeah. So how is the results of this study, Karen, how does it compare with other health professions when it comes to burnout and coping strategies?
Don't you wish this would be happy news, but it's not. I'm just looking at some of the statistics on burnout. It's terrible. It's endemic. It's part, and certainly worse with COVID, but, Medscape, as you're probably well aware of the data on physicians and nurses. Medscape does an annual physician burnout report, right? Every year. 2020, about 50% overall burnout, especially for I think urology and neurology came up as the highest, and then lower levels of burnout for general surgeons and psychiatrists. But having a psychiatrist brother right now, I know the stress he's facing. He's having to go back on call after being, something he hasn't done since he was a resident. So the stress on physicians is phenomenal. And I think you've all heard the terrible statistics of 400 physician suicides a year. So it's a problem. Nurses, yes, nursing burnout you guys know this, but shift work, understaffing. I read today that 62% of hospitals have nursing shortages. So I have a niece who is an emergency department nurse. She has seen it. She's 27. She has seen more people die in her little short lifetime. And she's a tough, resilient woman, but the stress is unbelievable. And I worry, she's hanging in there, but I worry about the long-term effects for these young, vibrant health professionals. PA, physician assistants, it seems like they're going to trend upwards as well, depending on what specialty they're in. So we're hurting.
Mm-hmm. Yeah, I think everybody is. There's just not as much data on every other health profession, right, as there is around the nurses and the physicians. And thank goodness you're shining a spotlight on physical therapy. I think that really helps as well. Because everybody's hurting.
Yeah,
right? Everybody's hurting.
So the work you're doing is so important.
And you too, right? Yeah.
It really does
all trying to do the best we can.
It takes lots of villagers, right? Lots of
it does.
Yeah.
We're all in separate villages doing the same thing. Yes.
Exactly.
Yeah.
Exactly. Well, another study that you were involved in was published in 2019 in the Health Professions Education Journal, and that was on self-compassion and compassion for others in physical therapy students, faculty, and clinical instructors. And this is really, was exciting to us because self-compassion and compassion is a polarity. And your colleagues really, you discussed the literature up until this point revealed a need to identify and apply strategies, right, to support effective coping and resilience during this education preparation and future healthcare providers. And the article states, and I'm just going to read this, promoting a balance between self-compassion and compassion for others appears to be such a strategy. However, no studies have examined their respective levels and differences in physical therapy students or their faculty and clinical mentors. So again, we appreciate you adding to the body of evidence of how this, this difference in self-compassion and compassion for others impacts physical therapies. So, Karen, can you share with us what were some of the implications for the physical therapy students in that study that you did?
Well, some of the findings were kind of interesting. As you know, that we found that physical therapists in general, and this is probably true of nurses and other health professionals, have more compassion for others than they do for themselves. And we found even higher levels of this disconnect in our younger students and our women students. And so the implications for us is that I think we need to realize that self-love is another health behavior, another important element of resilience. But we need to make that okay in the educational system. We actually have to talk about it. I think we need to talk about mindfulness. I think we need to talk about how we take care of ourselves. And I think one of the things that I think ties into this, that is part of another study that we are going to publish, is that many of our students are maladaptive perfectionists. I don't know if you've heard that term. But we have this is another part of our study, and it relates to the compassion. So we found that 93% of our students were perfectionists, but there are two kinds of perfectionists. The adaptive perfectionist going, I'm going to do my best and I'm going to give myself kudos for giving it a good shot. Whereas the maladaptive perfectionists set really high standards that are almost unachievable and then beat themselves up for trying. And so we actually talk about, what sort of, again, that explanatory style and that self-talk. The other issue that I think relates to self-compassion in kind of a less clear way is mindset. So if you have a fixed mindset where your intelligence is fixed and any challenge to your intelligence is stressful, I think an interesting study would be to say, does that relate to lack of self-compassion? If you have a fixed mindset, because people with mixed mindsets do beat themselves up. So the implications are we need to do better in the healthcare education system. We need to let students know, take care of yourself. You're not good for others if you're not good for yourselves. I think mindfulness is a professional behavior, and I frame it to them in that way. So I teach mindfulness. They learn how to meditate. They keep a journal on how they are improving their communication throughout the semester. If they fail tests, we're like, okay, what did you learn from the failure? Many of us are trying to be more creative with letting students take a test over again. What's the point, the grade or the learning process? And I think we tend to get really caught up in the outcome and not the process. So this is, I think, many layers to what we can do to improve self-love. Make it okay, number one.
Yeah. Yeah. Oh, I think that's a great revelation, right?
Yeah.
And like, not that it should be. It seems like we should know we should love ourselves, right? But we need research to tell us that. Oh, I think that's amazing. But you're not always taught that in your personal life.
Not at all.
To your point, right? And then when you get into a program like this, which is highly competitive, right? Yes. Then there's even more pressure on yourself, more chances that those kinds of behaviors, that maladaptive perfectionism is going to even expand more if there isn't somebody there telling you this is okay, right? This is a learning process. You don't have to be perfect at it. Yeah.
Exactly.
I think that's great. But what about the clinicians as they enter the workforce? Like, how can they leverage some of this to avoid burnout and compassion fatigue?
Boy, that is a central question, isn't it? We prepare them for all this. I tell my students, maybe this is my personal bias, but I will tell my students that one of the most important decisions you will make is where you take your first position. Are you going to you need to seek a culture of support and mentorship. And so I think a lot of our students, and this is another problem, that the debt involved in going to graduate school is so high. Our students are coming out with $100,000 and $200,000 worth of student debt. It's easy to be tempted to default to the fast, high-paced, high productivity work situation, which may not support you. And so, what I think it's very important for new graduates to choose carefully. The other thing is that our profession is recognizing physical therapist burnout as an issue. And so many of the state chapters of the American Physical Therapy Association are developing new practitioner special interest groups where there is a specific support for new professionals. And they're defined as new graduate to 5 years, which tells you it takes a while to learn this stuff. And so finding support within the profession as well as in your workplace. And then last of all, take your meds. That is your meditation, your exercise, your diet, and your sleep. And I didn't make that up. That comes from Nicholas Bate, who is a leading thinker in business and healthcare. But take your meds. So
I like that.
Every day.
Every day.
You got it.
Yeah. So that's an example of one of probably the recommendations that you have. Are there other recommendations that you have in relationship to what you found in that study? Take your meds, and is there other things in terms of what you found out around self-compassion and compassion for others?
We were actually looking for ways to support that in our students. And one of the great opportunities that we had was to offer the Healer's Art training, which was developed by Rachel Naomi Riemann, who is a wonderful writer, and Angeline Andarsario, who is the chair of the Healer's Art Initiative at Wright State University Medical School. It had been offered to PAs and nurses and physicians, of course, and I begged them to let them take physical therapists too. And so we have started this 15-week elective, which is meant to create meaning and purpose in our work through the use of the humanities, like written reflection, drawing, art, bringing the parts of ourself that we sometimes inhibit in our work situation. So it's really meant to bring your whole authentic self to your work. And there are, anybody can set up a Making Meaning in Medicine group where you can bring colleagues together and just talk about important things that you're doing. We did this last semester. We brought a bunch of our community physical therapists together. And the first thing we asked them to do was bring an object of meaning that speaks to you of why you chose this profession. And so when you are forced to re-articulate what brought you here in the first place, it can be really helpful. Yeah. The other thing that I've done in our program is I have instituted a day of gratitude in my communications class. And so, I'm saying gratitude is a form of communication. Positive affirmation is a form of communication. So the students are given index cards for every member of the class. They're asked to write a positive affirmation or some gratitude message. And then I collate them and hand them out like, remember your old Valentine's Day boxes with all your Valentines?
Yeah.
They get their gratitude cards. And it started out as just kind of, let's see how this goes, but it has become a standard in our department. I mean, I've left NAU, but the students still want to keep doing it, and I'm hoping that it continues. Students will tell me that they keep their cards after graduation. It means that much to them. So strategies of finding education that supports you and keeping that gratitude alive, those are things that we have done.
Yeah, I think that's great. I know one of the things that struck me as I was reading through the article And thinking about the self-compassion and compassion for others as a polarity, I was thinking it'd be great to measure that using a polarity assessment.
Yes.
Because you not only measure what they're experiencing, but the interdependency between the two and how they're balancing that. And I think that would be a phenomenal study to do. Maybe we'll have to partner with you on that.
Yeah.
I'm all in.
Part 2.
Count me in.
I think that'd be great.
Part 2 coming up.
Yeah, there we go.
Okay. So what is your greatest hope for future physical therapists as they enter the workforce right now, Karen? What gives you the biggest hope?
This is such a wonderful profession. There's so many opportunities to be of service. I want them to find a meaningful, supportive work position. I want them to take care of themselves and keep the joy of why they're here and what they're doing alive. I want them to feel empowered to make change in the healthcare system. And one thing that I love about the millennials and Gen Z students that I'm working with is that they're going to do this. And I'll tell them, I hope you fix this in your career lifetime. And please don't blame us boomers for breaking the system. We didn't like it either. But I really hope that they help change the system because we all know it's not working.
Yeah, no.
Yeah. It's not uncommon. We ask several of our guests about what their greatest hope. And I can't, now that I'm sitting here, Tracy, so many of them, it is the younger generation coming up that gives them hope, right?
It does.
To lead the way. Lead the way in a new way.
Yeah. Well, I think that's probably true of all generations, right? They really hope the next one does better than they did.
We just go, sorry for what we did to you.
Passing the baton. Yeah, here you go. Sorry. Good luck with that. I ran my lap as fast as I could. Well, it's been great, Karen, talking with you and hearing more about your incredible work. And so we always kind of like to wrap up our interview with the missing questions.
Ooh, okay.
Okay. Now, this is just really, we've heard a lot about your professional side and all the contributions you've made, which have been incredible. And we just like our people to kind of get to know you a little bit on the personal side. So we're going to ask you a few personal questions. Nothing you can't handle, nothing to be nervous about. Don't get your blood pressure up. You can relax for this one. Yeah. Yeah. There
I'm
you
very
go.
cool
You
here.
got it. You got it. Cool as a cucumber, I bet. All right. So here we go. The first one is, as a health and wellness coach, what's one coaching recommendation you give to your clients that you find you have to work the most on yourself?
It's that reframing of the thought process.
Yeah.
Yeah. So
Me too.
clients come because they feel stuck. They feel stuck. And, it's like, well, let's talk about what, it's interesting to sometimes invite clients to like step out of their brain and be somebody else. Like, what is that person saying to you? What is that harsh person saying to you? And then is there a nice side over here that might be able to give a counter, stronger argument? So that's what coaching just allows us to guide the person to their own inner wisdom. They know that they just need they need helpful questions, thoughtful questions.
Yeah. Sure.
But it's amazing that when you just open that door, they have the wisdom.
Yeah.
Yeah.
They just need somebody to help them see it.
Right.
Yeah. And we do too. And that's why, right? It's ongoing. It's just ongoing. It's never stops, right? Because a lot of the thoughts you have are so subconscious, you're not even aware you're having them. I started a new thing. I start putting that negative voice in timeout. I'm like, go to timeout. That seems to be helping a little bit.
Oh, that's great. That's great.
Oh,
That's
okay.
great.
Another question for you. All right. What is a favorite hobby of yours that fills you with joy and helps you combat burnout?
I love being physically active. And so the two things that just make me so happy are yoga. I have a pretty consistent yoga practice. That gets me out of my head and into my body because my head is an active, crazy little place. And so doing yoga has been helpful. It also is keeping me strong. And as we all know, as we get older, that's harder to do. And then my very favorite thing to do is put on headphones, crank up some good rock and roll and dance. And I do that twice a week. And it's ugly,
awesome.
but it's
By
private.
yourself or with others?
No one sees up at me.
Okay. By
Okay, so you're
yourself.
doing it by yourself.
Oh, yeah.
Okay.
I love
right.
that. And then I am really getting into art. So I've been painting mandalas. I've done some mosaics. I'm trying to get that other expressive side healing as well. So those are the hobbies I really
Get that
enjoy.
right
My
brain.
husband and I walk every day too. We love that.
Great. Awesome.
Oh, cool.
Awesome. All right, Karen, we have a wrap-up question for you. So as you know, we teach polarity intelligence to leaders and how to think both and one of the principles of polarities is even though things are an interdependent pair, we have a preference pole. We just naturally have a preference pole that we lean more towards one than the other. So I'm gonna share a polarity with you, and we want to know where you sit, what your preference pole is. Okay.
Cool. Okay.
Okay. Self-compassion or compassion for others?
Self-compassion, very intentionally.
Yeah. Yeah.
That's good.
That's good. I think you live it. You've been sharing with us how you live it. And I think you can bring it in a way to others too, to help strengthen that particular side of the polarity as well.
Mm-hmm. Yeah.
Oh my goodness, this was such a delightful conversation, and I'm so grateful to have you on our podcast. I want to give a shout out to our good friend and colleague, Jody Frost, who introduced us to
Jody!
you.
Yeah, great friend.
Yeah, she's been on our podcast as well, and we really were seeking out physical therapists that were doing work with well-being and combating burnout. And I think I can't think of another person we could have had that was better. So thank you very much.
That was
I
wonderful.
so enjoyed the conversation with you too. And the work you're doing, oh my goodness. Thank you.
Yeah. And I think, what I noticed throughout our conversation was the power of choice and agency. And it started right when you told your story about making a very difficult choice, but you made it because you knew it was in your best interest and in the best interest of the greater good as well. And then even in your research, right, as individuals are making choices about where they were spending their time, right, choosing to spend time with something that filled their cup made a difference for them more than it did for the other students. And then even at the end, your choices around the things that fill you up and help you to have that self-compassion for yourself. I think it was just a great theme throughout our whole conversation.
Yeah, absolutely.
Wonderful.
Thanks.
So thank you very much.
Yeah.
Thank you. I'm going to be following you guys closely I'm a big cheerleader for what you're doing. Thanks again.
And us for you. So
yeah. And for all of our listeners out there and watchers on our YouTube channel, this wraps up another great episode of Healthcare's Missing Logic podcast. And we will see you next time.
All right. Bye, everybody.
Bye.
Take care. Stay healthy and safe.
We hope you enjoyed this episode of Healthcare's Missing Logic podcast, now a top-rated podcast for healthcare leaders. Please share this podcast with other healthcare leaders and anyone else you think would benefit. We are certain that if you found value in it, they will too. If you haven't already done so, please hit that subscribe button so you don't miss any episodes. And also, it would mean the world to us if you took a quick moment to leave a rating and review on Apple Podcasts, Stitcher, or your favorite podcast player. It helps to get the word out about our podcast and incredible guests. Be sure to subscribe to our YouTube channel if you want to watch our podcasts. You can also follow us on our Missing Logic social media channels, LinkedIn, Instagram, Facebook, and Twitter. Until next time.